The gut microbiome is fascinating to me. It's having a big influence on many parts of our health and also our emotional and mental health as well. And you can modify some of that by using probiotics and their cousins, prebiotics. We're going to get into all of that today with our guest, Gregg Russell, pharmacist and nutritionist from Fort Wayne Custom RX. Welcome back to the program.
Well, thank you, Lee. It's a pleasure to be here.
What is it that these microbes are doing that make them so critical to my health?
Well, they are certainly modulating our whole physical body. And our immune system, our brain, and our digestive system are intimately connected, and these microbes play a really important in communicating back and forth your different body parts.
They're kind of a little drug factory in and of themselves, right?
Yeah, as you said earlier, there is billions. I think I saw 10 to 14 log. That means about 10,000 trillion bacteria, if you really think about it, and that's a little bit more than our national debt right now. But there's more DNA in them than probably regular DNA in our body.
Yeah, exactly. It's fascinating. There are conditions that are directly associated, and many people now think influenced by what's going on in your gut. What are some of those?
Well, a lot of things influence, especially the outside environment, and a lot of studies have shown, have looked at children, for example, whether they were delivered by vaginal delivery or whether or not they were breastfed. We now know that there's been population studies looking at people's different diets, looking at, for example, the way Asians eat versus Western civilizations, and that the gut microbiome is basically made up differently according to what our exposures are.
Yeah, I just read an article in The Atlantic. In fact, I just discovered it this morning. It was fascinating, saying that if you have more of a particular type of bacteria in your gut, Clostridia, you are more likely to be thin than if you have another type of bacteria. And so this theory is that whether or not you are able to gain or lose weight has a lot to do with exactly what is in your gut, the bacteria living inside you.
Absolutely. And different nutritional manufacturers, as well as I think you're going to see the major drug companies themselves, are actually targeting specific strains to do different things. For example, there's a Lactobacillus reuteri that's being targeted, a very specific strain that's being targeted that actually helps block cholesterol absorption. So in other words, it could be used for people that have hyperlipidemia or high cholesterol.
Fascinating stuff. I am just so intrigued by all of this. Let's talk a little bit about what we can do to modify that. So our diet has a big influence on exactly what is living inside of us, but there's also probiotics and prebiotics so that you can take things intended to modify that environment. What's the difference between a pro and a pre?
Okay. Well, probiotic is the actual bacteria itself. Okay, that we are repopulating. And we used to think, I call it the true green theory, that, the way to have a nice yard is to keep weeds out, right?
Right.
So the thought was we give people these probiotics and that would cause them to grow rapidly in the digestive tract. However, that theory is really wrong, because when we really start looking at the amounts of probiotic we're taking, it's making a very minor difference in the actual numbers of a bacteria. You can't choke the weeds out that way. So now we know that probiotics play a really important role in communicating with different markers, different enzymes, some of them called cytokines, that have a major role in inflammation. Right. So probiotics are made of basically two strains, Lactobacillus and Bifida, and then there's substrains behind that, and that's where we start having what I call the probiotic wars between the different nutritional companies.
Which one is doing the job
Which
best?
One's doing the job
So that's
best.
A probiotic. We're actually consuming bacteria that we want to have in our guts. Now, what is a prebiotic?
A prebiotic is something that is like fertilizer. In other words, the goal for that is these are substances. These are what we call saccharide-type sugars, polysaccharide-type sugars that actually our body doesn't digest. They continue passing through, so fiber plays a role also. The two big ones are arabinogalactan and fructooligosaccharide, and those allow places for the feeding of the probiotics or our bacteria, our good bacteria.
So I need to take them both, or do I take one or the other? How do I know what I'm should be doing?
Everybody needs to take a probiotic. I truly believe that. The The difference is whether or not, so for example, the example I gave earlier with the Lactobacillus reuteri, that product comes with a prebiotic, and you aren't taking a large amount of bacteria. So this kind of feeds them, and so yes, you do take the two together. Many probiotics don't really need prebiotics, and prebiotics have an added risk of causing more bloating and gassing.
Okay. What are some of the things that I may be eating, drinking that are going to disrupt everything that's happening, that little party down there in my intestines?
Sure. Well, I think probably the most obvious is bad food choices. Bad food choices, being really high refined carbohydrate diet. A diet very low on good fiber is going to tip the scale for bad bacteria production. And so that's probably number one. So we tell people to try to eat as plant-based diet as they can and eat organic meats, drink good water, get off the things like the colas and the soft drinks, because those things aren't good for many reasons in your digestive tract, but they certainly can tip the scale. There's also some type of prescription drugs and anti-inflammatories like ibuprofen or Aleve that we've talked about in the past. So there's many different things that can affect that, Lee. Yeah.
Hey, we have a phone call. Let's get to it right now. Pat, your question for Gregg Russell. Go right ahead.
My question is, on a previous show, you said that prebiotics are in cruciferous vegetables, and I was wondering if the processing of what they call natural foods like Texas Superfood and Brickhouse Nutrition, just to name a couple, if the processing does away with any of these, processing of fruits and vegetables, does away with any of these prebiotics.
No, they sure do. Anytime you refine, you heat, or you're going to take some of the natural properties out of a food item. So there's some fermented foods that are excellent pre and probiotics, and those foods are the things like that we've heard of, kefir and yogurt and things like that.
Sauerkraut and kombucha, that kind of stuff.
Right, all that stuff, and the fermented foods are good for your health in general.
Okay, Pat, thank you for your question. And if I'm taking a probiotic, how do I know that the probiotic I'm taking is going to be effective? Because you can buy these things anywhere.
You sure can. Well, first of all, you have to select a good manufacturer who really knows what they're doing. These bacteria have to be grown in special vats. They have to be processed. Some of the manufacturers will tell you they need to arrive to you in a refrigerated cooler. Some of the companies make them in freeze-dried. So that they're shelf stable. So you have to look at those companies and see how reputable they are. And then, of course, we try to use the probiotics that have the best research. So, for example, for Crohn's and ulcerative colitis studies, the most popular and the best known probiotic, especially among physicians, is VSL number 3. And there's an over-the-counter strength, and of course, then there's a prescription strength. Now, these are what I call the granddaddy of them all. Probiotics. They are very high counts, have a lot of different strains in them, and they're very potent, so they shouldn't be just bought by anybody. They need some counseling.
I want to jump in here because Gregg's really a little bit too modest to do this, but I think that's one of the reasons that you go to a place like Fort Wayne Custom RX, because you have the time to give each customer some education and guide them through a product selection. And that is so important when we're talking about this stuff.
It really is. There's, we try to find products that are going to meet your need. So, for example, if women have constant urinary tract infections or yeast infections, there's better bacteria targeted for those things than we just want to give somebody an overall cheap GI stabilizing type product.
Yeah. So antibiotics are the nuclear bomb to our system, right?
Mm-hmm.
I mean, you take an antibiotic to clear up, let's say, an ear infection in a child, but you're also then whacking lots of bacteria in their digestive tract, and that can result in diarrhea and some other problems.
Sure.
Anytime you take an antibiotic, should you also be then taking a probiotic?
Oh, I believe so. And again, antibiotics are kind of, like you said, a bomb. They don't just kill the bad bacteria. They're not selective enough, so they may kill some good bacteria, and that's what happens with a C. difficile infection, for example. There are certain really potent antibiotics, probably levaquin and ciprofloxacin are the two most common that we see, but they'll go through and they'll kill certain bacteria that then allow a yeast called the C. difficile toxin to secrete a substance that causes profuse diarrhea that can be actually life-threatening.
Yeah, and exactly. It goes on for weeks, very difficult to control. Mm-hmm. And one of the most effective ways, this is fascinating to me, it's kind of gross, but it's fascinating. One of the most effective ways to handle C. diff they found is to do a fecal transplant. Can you put a few seconds on that?
Well, sure. This is kind of the latest and craziest thing. So, choose your donor wisely, right? So, a lot of times they find a donor, somebody in the same family, because it seems that genetics play a role in this too. And somebody, maybe it's a twin sibling, for example. One gets UC or Crohn's and the other one doesn't. However, it could be any type of person, and they actually do an enema, or they do it actually by putting it down a nasogastric tube through your sinuses, and there's protocols for that. These are for the most severe patients that are resistant to any form of treatment. So it's not standard care.
Right.
It's more research right now.
But it's fascinating that we're harvesting some of that microbiome from one person and using it as therapy, as medicine for another person. And they have found, this I think is just fascinating, they have found that if you take the fecal profile from a non-autism child and put it into a child with autism, you often see a dramatic behavior change.
That's very interesting.
Yeah.
So that needs to be further elucidated on. But it just goes to show you the major impact of what changing a microbiome is. And back a few years ago, they said this was going to be the biggest thing that we're going to study in this century is understanding our own microbiome.
Yeah, I believe that. There's a huge amount of research out there right now. Mm-hmm. Okay, so what are some conditions that you have seen in your patient base actually see benefit from probiotics?
Well, just about anybody that has some form of irritable bowel, we have to really do a full questionnaire workup on them. Now, sometimes doctors will send us lab work. Sometimes we're just getting the information. But what we do is we try to clean up the gut, and to do that, we give them a little information about how they can eat cleaner and better. We work on giving some herbs and things that are anti-inflammatory or other types of products that also heal. But in all of that, the mainstay is we do selective probiotics that work.
What about probiotics for kids? We talked about the ear infection, and kids take so many antibiotics. I think most of the antibiotics that a human consumes happens in the first 10 years of life, I've read. So are probiotics safe for kids, and do we need to treat that any differently?
Again, considering you have generally a healthy kid, they are. All four of my grandchildren, for example, I have on probiotics, and the youngest one is under 6 months of age. So, they are important. Especially if you're breastfeeding, you're giving them bacteria. If you're giving them infant formula, you're not giving them bacteria, and it's important that you give them some. Again, there are specific strains that can be used in children that are very young.
And then what about dosage? If I take probiotics and don't notice a change, should I take more?
Well, either more or maybe we'll have to switch to a different type. Sometimes these changes are so subtle, it takes months for you to really see them, because again, what we're doing is we're actually changing your body. We're changing the bacteria and the way they respond. And there's actually an excellent book, one of my favorite books, Lee. It's called Bacteria for Breakfast. Isn't that a snappy title? It's written by a pharmacist who has really done a lot of research on the immune system, and she's written all these abstracts up. And her personal story was her son was about ready to die from C. difficile, and they used VSL number 3 this back about 15 years ago, 20 years ago, and it saved his life. And so then that made her very interested, because she was a PhD. She worked in a pharmacy school to do some research on that.
Okay. My wife has, I'm just going to call you out there, sweetheart. My wife just sent a message for you. Our grandson, 6 months old or so, has an ongoing ear issue, an upper respiratory infection. Are there specific probiotics for infants like that, or where do I find that kind of information?
There is. We would want to get them probably a chewable or a drop, and one that would really focus towards more for the sinus ear infection, because that's going to help with balance that replacement of what's going on there. There are certain bacteria that, of course, cause those diseases.
What do you think is going to be the next big thing that happens in this arena with gut health?
Oh, I tell you, gut health is the most important thing. I would love to go through multiple sessions with you on this, but I think certainly treating things like depression and sleep issues is really huge. Anxiety, the parallels between anxiety and digestive health has been known for years, and now we're starting to know that, for example, tryptophan makes serotonin. Tryptophan's made in the gut or in the digestive tract, and if you don't have the right bacteria balance, then it breaks it down so it doesn't get turned into serotonin, and it turns into like an inflammatory substance.